Chapter 4, Crisis Prevention and Intervention in Healthcare. 1.0 Introduction. Healthcare professionals require the information of a patient with assaultive behavior to prevent and intervene in the event of crisis. This information is used in the implementation of appropriate preventive measures. The traits of patients and victims of assaultive behavior should be recognized to assist the patient and the victim accordingly. This chapter will discuss how patient history with violent behaviors is obtained. It will also provide the characteristic of aggressive and violent patients and victims. 2.0 Obtaining patient history from a patient with violent behaviors. The history of an aggressive and violent patient can be difficult to obtain if there is no record. Hospital records should be handy when gathering information. The patient history enables the healthcare professionals give the most accurate intervention in a given situation. 2.1 Identifying sources of information. Obtaining information from patients with aggressive behaviors may be challenging because the aggressive patients are not usually willing to cooperate and disseminate negative information about themselves. By the way, who would like to say something bad about themselves? The information can be obtained from family members, medical records, friends, and the police as well as healthcare workers. Some patients may be willing to provide information and be involved in the decision-making and should be allowed. Family members may be a good source of information on how current events happened and how past events occurred. Friends of the violent patient can give additional information on behavior, for example, if they have been substance abusers. Some of the friends, family members, members of the public may have been victims of his assault. The police may have current and past history about criminal activities and arrests. The medical record is a reliable source of information. Dubin, 1993, p. 10. 2.2 Preparing. The history of a patient behavior and condition is very significant when it comes to making decisions on healthcare practice and should be conducted when the healthcare professional is ready. Eichelman and Hartwig, 1995, p. 84, suggest that, before attempting to gain the information from the violent patient, prepare self by clearing what is in the mind. If the records are available, the healthcare provider can view the last significant problem presented. Consider the available time for obtaining the information and if it is the correct timing. Develop a strategy to use in case the patient becomes violent. Handle the circumstances with confidence and calmness. Information should be sought after the patient and the healthcare professional are calm. Get ready for responses void of argument and heated disputes. The healthcare professional can acknowledge the upsetting situation the patient is experiencing and assure them of assisting them. Plan to de-escalate any possible trigger. Eliminate situations where the patient might feel confronted. 2.3 Eliminate triggers of aggressive behavior and use appropriate communication skills. From observation made when the patient is aggressive, identify events that led to aggressiveness. These could include frustration, intrusion to the patient's privacy, anxiety, fear, feeling threatened, discomfort, and pain. Manage their pain and avoid abrupt movement or noise. Avoid all the triggers that could lead to assault. They can be made comfortable by giving appropriate meals and adequate drinks. Keep away from rushing them to do something and inappropriate demands. Explain actions before you attend to them. Give simple explanation and give them time to give an answer. Do not show when offended and evade criticizing the patient. The healthcare professional can listen to the patient and avoid writing or getting distracted when what the aggressive/violent patient is saying is of relevance to them. If there is need to write, notify them and allow them to complete talking. Take note of topics and activities that interest the patient and use them when necessary to call for their attention. Be a good listener and ask all relevant questions without offending the patient. 2.4 Gathering the information. Obtaining data from patients may take different forms when the healthcare professional begins obtaining information. They may give single-word answers, may present themselves with a self-diagnosis and demand for medication, may need continuous reassurance, and may be angry or show tendencies of assaultive behavior. Questions can be effective in gathering information if they are not addressing specific issues. Polite steering of phrases can also help get information. Reassure the patient of confidentiality at all times. Avoid interrupting the patient when giving their first statement. Canale 2012, p. 33. An example is a patient that came into a mental health facility claiming that he was God. His delusion of grandiose was so strong that he was narrating his experience when he was being crucified, told of how he was so exhausted before Joseph of Arimathea came to help him carry the cross to Calvary. As nurses obtained data during his admission, one of the questions was, "Do you have problem with anger?" He was asked the question and immediately he burst out into a very loud and infectious laughter, laughing so hard and finally ended up asking the nurses, "Do you have problem with anger?" Information sought consists of demographics, which includes their age, gender and marital status. Find out if they have social support from friends, family or community. Get details of their involvement in previous assaults, abuse of substance or alcohol and other sicknesses. Check and record physical traits that may imply involvement in aggressive behavior or crisis. Also, record verbal indicators that suggest the mental imbalance of the patient. The healthcare professional should remain focused when questioning the patient, relatives, friends, other healthcare professionals, and police as well as when looking for relevant material. Concentrating and focusing on causes, concerns, and underlying issues that necessitated the patient's visit to the hospital is essential. It is very easy to be carried away by the patient's interesting history, thereby forgetting the relevant details. The patient and their family or friends at times need reassurance and confirmation, which should be received well. Patient-tailored assessment gives the healthcare professional's ability to identify the needs of the patient and their anticipation. 2.5 Identify common issues. After conducting the search on the patient with aggressive and violent behavior, a record of the observations and information obtained should be documented. This will be useful in the future, especially in the coordination of patient care. Information obtained will reveal what causes or triggers the violence, intervention that is given and the effectiveness. The information makes it possible to identify underlying issues that need to be addressed. Issues that are unique to the patient are identified. The information will give details of social history, medical history, family history, possible use of drugs and excessive use of alcohol. 3.0 Characteristics of aggressive and violent patients and victims. 3.1 Emotional and behavioral characteristics, been abusing substance or alcohol. Common behaviors that violent people have include constant desire to call for attention, agitation and restlessness, fear and emotional attachment in their conversation, augmented motor activity, disorderly, antisocial and disruptive. Consequently, aggressive patients may become confused and become wild. The victim of emotional and behavioral assaults may feel devalued or dehumanized. Poor communication will cause hostility and misunderstanding. 3.2 Physical characteristics. The violent patient can exhibit verbal or physical abuse towards self, healthcare professionals, relatives, non-relatives, animals or objects. Patients with assaultive behavior could be young adults in their early 20s or teenagers. Although majority of violent patients are young, there are elderly patients who become violent. Both men and women could possess assaultive behavior traits. Although it is worth noting that majority are men, women cannot be underestimated, especially in the case of mental illnesses. Patients with violence might have had head injury and trauma. A violent patient may have a weapon, or objects that can inflict pain on others. Both fresh and old wounds may be seen on the violent person's skin. Aggressive patients use inappropriate physical contact to inflict harm on self and others. They use force to slap, beat, bite, spit and kick. The physical actions of a patient with assaultive behavior includes using unacceptable contact to create a situation that is uncomfortable and hostile. Victims of physical assault fear the aggressor. 3.3 Personality characteristics. Aggressive patients have a low level of tolerance when they are frustrated. Violent patients at times reject criticism and want to be in control. They tend to blame others for faulty results that involve others or self. Patients with violent personality may engage in antisocial behavior, selfishness, careless driving and egocentricity. Patients with low intellectual abilities can become violent when compared with the intelligent patients. Patients from low social and economic status tend to become assaultive when compared with those from a high social status. Violent patients may be comfortable with the assaultive behavior and live it as a lifestyle. In this case, the aggressive patient does not have remorse. Insults and aggressive behavior is used as a way of manipulating others. As a result, the aggressive person becomes involved in breaking laws. Some patients with violence had been trained on violence as police or other law enforcement agents. 3.4 Relationship with others. Aggressive patients tend to have poor relationships with the healthcare professional as well as the other patients. They may try to convince and take the other to an activity. They may not communicate effectively. Other patients who are calm tend to dissociate themselves from them. The aggressive patient may want to intrude the personal or physical space of the healthcare professional, other patients, relatives or friends, disturbing the existing peace. The patient may react negatively towards treatment, relatives or assistance. They may retaliate if they feel not treated right. Violent patients may perceive others as being in competition and fail to cooperate when granted help. The aggressive patient can provoke and tease patients, relatives, friends or healthcare professionals in the healthcare facility. The healthcare professionals need to re-emphasize the rules of the unit and state the consequences of breaking those rules. It is paramount to remind the residents of the mental health unit that the staff are their friends and are working in the facility to ensure the improvement of their health status. Since the presence of a poor relationship between the staff and the patient makes the potentially assaultive patient to become violent, the healthcare professional needs to ensure that adequate communication exists between the two parties and proper and therapeutic techniques are being utilized to ensure a very conducive environment. 3.5 Medical and Substance Use Traits. According to Tardif, 1999, p. 153, mentally ill patients are likely to become violent. Patients with bipolar disorder, depression and schizophrenia tend to engage in violence. Similarly, patients who abuse substance and alcohol are at times violent. Paranoid patients and those with hallucinations can become violent. Violent patients may have depression, accompanied with hopelessness and suicidal tendencies. This occurs if treatment has not exerted remarkable improvement or if the patient does not adhere to the medication regimen. The victim of violence becomes fearful and anxious after they experience assault. Their confidence and self-esteem is affected, which could lead to a withdrawal from giving support or adequate health care to the patient. They attempt to change behavior and please the aggressive patient to avoid being victimized again. The victims tend to withdraw and blame self for the aggressor's violence. They become tensed and guilty. They are terrified and may want to run away. In some cases, they may want to defend self by inflicting harm on the patient. Other victims feel ashamed because they were helpless and not able to change situation. Healthcare professionals who have experienced violence may not want to continue working with the identified violent patients. If persuaded to work, they may demand that the patient is strictly cautioned about causing violence and verbal abuse. Injuries or bruises from the assault may cause indignity on the victim. Blumenreich and Lewis, 1993, 22. Healthcare professional victims who have encountered violent patients are predisposed to making medical errors and failing to satisfy patients' healthcare needs. Scared victims excuse themselves from working. The motivation to work for the same unit is negatively affected, especially if the violent patient is not responding to treatment. It is, however, very important to state that many healthcare professionals have been working for years in mental health units, and have never been assaulted or hurt by the patients because they have been applying the safety measures as outlined in this book. 4.0 Conclusion. History of patients with aggressive and violent behavior can be obtained by identifying sources of information. Information can be obtained from the patient, relatives, friends, police, observation and medical records. Once the source is identified, the healthcare professional can prepare self psychologically and physically. Get rid of triggers of aggressive behavior and apply appropriate communication skills. Gather the information by focusing on relevant information and get the patient's consent. Identify common issues, and keep record. Violent patients are characterized by negative emotions and behavior. They may be physically aggressive and have personality traits of exhibiting violence. They have poor relationships with other people, may have mental illness or use drugs. Victims of violence have fear, anger, blame self, are terrified and make effort to run away. Victims may have depression, low self-esteem and negative self-image. Some have injuries and tendencies of revenge. If not assisted, victims may hurt self or die from injuries.